Fellow Ghanaians, good evening. I came into your homes on 17th January to give an account of our COVID-19 situation, a situation which, per available data at the time, was not good. To this end, I appeal to you, my fellow Ghanaians, to help contain the spread of the virus by respecting the protocols government had put in place. The hope was that we would begin to see an improvement in our case count as a result. 2 weeks on from that address, the situation is even worse. As of Friday, 29th January, 64 more people have sadly died over the last 2 weeks, bringing the total number of confirmed deaths to 416. Our hospitalization rates are increasing, with the number of critically ill and severely ill persons now at 172. Our hospitals have become full, and we have had to reactivate our isolation centers. Our average daily rates of infection now stand at 700, compared to 200 2 weeks ago. The total number of active cases has more than doubled, from a little over 1,900 2 weeks ago to 5,358 currently. When I delivered update number 22, 13 out of the 16 regions had recorded active cases. Today, all 16 regions have active cases. Indeed, Greater Accra, Central, Western, Ashanti, Eastern, Upper East, Upper West, Volta, and Northern regions are the hardest hit, accounting for 94% of the total number of active cases. In effect, fellow Ghanaians, we have a lot of work to do in coming to grips with the disease. Given that recent studies show that the UK and other new variants are being transmitted within the population, we should all understand that our current situation could get very dire if efforts are not made, both on the part of government and by you, the citizenry, to help contain the virus. The analysis continues to tell us that the spread of the virus mostly occurs in indoor confined spaces with poor ventilation, where people are talking, singing, or shouting without their masks. The imposition of restrictions on our daily routines helped in reducing the prevalence of the pandemic in the country, and government has been left with no option but to reintroduce some of these restrictions in order to help save the situation. I know these measures in the recent past were unpleasant, but over a period, they resulted in a favorable situation for the country. We have to return to them. So, fellow Ghanaians, until further notice, funerals, weddings, concerts, theatrical performances, and parties are banned. Private burials with no more than 25 people can take place, with the enforcement of the social distancing, hygiene, and mask-wearing protocols. Beaches, nightclubs, cinemas, and pubs continue to be shut. Our borders by land and sea remain closed. All workplaces, public and private, must employ a shift system for workers, in addition to the use of virtual platforms for business or work. Conferences and workshops can take place with all the appropriate protocols. However, I encourage the use of virtual platforms